I am going to preface this presentation by saying that all of these facts stated in this presentation are supported by references that do not necessarily reflect my direct opinions. Body mass index, or BMI, is most commonly used to assess the degree of body fatness and classify an individual's body weight. While BMI may in some cases be a beneficial predictor of various health outcomes associated with excess body fat, at the individual level, it should be considered a guide, recognizing that it may not correspond to the same degree of fatness in different individuals. Stepanek includes an example in the text that an individual with a large muscular build may have a high BMI that is not due to excess fat tissue and is not associated with health risks. Due to the fact that BMI is not an accurate predictor of body fatness for all individuals, as a nutrition professional, BMI should not be considered a valuable tool. In addition to athletes, BMI may vary in individuals of differing races and ethnicities. When compared to Hispanic and white individuals, African American individuals, especially females, tend to have a higher mean BMI and waist circumference. This prevalence of obesity is hypothesized to be due to health behaviors in addition to obesogenic environments. Studies among adults indicate that African Americans engage in more poor health behaviors as compared to white individuals, including poor diet, smoking, and excess alcohol consumption. Other populations' overall BMI may be affected due to social and economic advantages or disadvantages. For example, underdeveloped countries suffer from higher rates of unemployment, higher rates of food insecurity, greater access to poor quality foods, poorer access to healthcare, and unsafe areas to engage in physical activity. Due to the varying average BMI in each racial environment, in addition to BMI discrepancies in athletes, alternative health metrics should be utilized. Other, more effective metrics to utilize body composition include waist circumference and the use of skin fold calipers. Waist circumference measurements are useful in determining the risk for chronic diseases. A waist circumference of greater than 40 inches in men and 35 inches in females puts individuals at a greater chance for the development of cardiovascular disease and diabetes. In addition to the discrepancies associated with BMI, waist circumference is also considered to be a stronger determining risk factor in the development of cardiovascular disease. When considering the role of obesity in the development of diabetes, visceral or abdominal fat can be evaluated through waist circumference measurements. The mechanisms through which visceral obesity results in insulin resistance appear to be related to excess lipid accumulation in the liver. Excess lipid accumulation may result in impaired insulin signaling through cell mechanisms or through the induction of inflammation and the subsequent production of inflammatory cytokines by macrophages, which impair insulin action. Skin fold calipers are utilized to measure skin fold fat at various anatomical sites to predict an individual's percentage of body fat. Skin fold thickness is considered to be a better predictor of body fat ratio as compared to BMI. In conclusion, due to potential errors regarding the differences between overall muscle mass and body fat content, and differences among ethnic populations, BMI should not be used. Rather, waist circumference and skin fold thickness measurements are more beneficial. Several studies indicate that both of these metrics are more useful tools in assessing body fat ratio as compared to BMI. As a future healthcare professional, it is imperative to conduct further evaluations on patients that are considered to be overweight and obese. Is the patient truly overweight, or are they just a muscular build? By measuring waist circumference, at-risk individuals can properly be diagnosed and treated with interventions to prevent the development of chronic diseases.